Hello, I'm Jesse Wild, orthopedic surgeon here at Tucson Orthopedic Institute on the east side at TMC. After your total hip, I've got some goals that you can walk better, get on to enjoying your life, be more active, and obviously with less hip pain. To manage your health after your hip replacement, it's important that you really go over your instructions, try to leave the hospital with understanding from the nurse, have your physical therapy arranged, follow some of our instructions and precautions, and we look forward to seeing you at 2 weeks. If there's any real setback or concern before we see you at the 2-week visit, then obviously reach out to us either on phone or through our patient portal system can be easier. To manage your pain after the hip replacement, we really favor a multimodal pain approach. Idea being we use a few different classes of medicines, and starting that with simple medicines like Tylenol. Tylenol scheduled into your life somewhat in the early day for many of my patients can help minimize the amount of stronger medicines like narcotics that you need. Similar to Tylenol, but working in a different manner would be an anti-inflammatory. Commonly, you'll see Celebrex in your discharge prescriptions from us, and there's other types of anti-inflammatories we may choose. And again, the idea is to minimize what you need on a narcotic front. And then speaking of narcotics, you'll see something stronger like Tramadol or Vicodin or oxycodone in your discharge paperwork. And that's of course the strongest agents, and we have you minimize those because they also have side effects, but use them when you need them to help with sleep or to get through physical therapy. And then last, if nothing's working, we'd have you reach out to us, patient portal or telephone, and we'll try to help you troubleshoot the pain. There are some side effects with these medications, including the pain medications and constipation, itching, depression, various side effects, principally to the narcotics or the oxycodone-like drugs. Weaning off of those pain medicines is a big part of minimizing the side effects, again, say constipation, and also a big part of why we use that multimodal pain approach. We'd rather see you with the Tylenol and Celebrex and ice packs and less reliant on oxycodone, or at least for a short amount of time. And then if you do run into constipation, stool softeners are a good idea, and maybe preemptively they're a good idea. Prune juice is a simple over-the-counter remedy. And then many of you will leave the hospital with instructions or prescriptions on a stool softener. Other medicines that we'll prescribe often have to do with blood clot prophylaxis. For many of my patients that we consider low risk, we're just down to using a baby aspirin or an 81 milligram aspirin twice a day for a month to help lower your risk of a blood clot after hip surgery. On occasion, we have people that we consider maybe more moderate risk or higher risk for blood clotting, and then we'd try bigger medicines commonly like Eliquis. You might see, and that again is often twice a day for about a month. And in more complex cases, we may even include your cardiologist or your medical doctor in that decision. After your hip replacement, we use a couple of different dressings over the incision, and one that you might see is an Aquacel bandage that's very occlusive and adhesive and is good at keeping infection and even shower water right out. And it's nice, many patients who leave with an Aquacel can shower with that on as early as they get home, the day after surgery. That Aquacel then stays on for about 10 days, and we give you instructions to peel it off at about 10 days. Some other hip patients might, depending on the situation, leave with a simpler dry bandage with some tape over top or another adhesive over top, and then we would clarify instructions to maybe take that off in 3 days or so. And then in either setting, if the wound is dry when the bandage comes off, they can continue showering, leave it open to air. And then if we saw drainage later, we'd want you to reach out to us if you had a draining incision. That's something we'd want to hear about. After hip replacement, some things to look out for would include fever, and really talking about a legitimate higher fever of 101 degrees, something that really catches your attention. Similarly, chest pain, trouble breathing, we'd want you to reach out to us or your primary care doctor, or even go to an emergency room setting if that was needed. Incisional concerns, we'd want you to reach out. The incision should slowly be getting better after surgery. And then mechanical concerns, if you had an injury or a fall, we'd want you to reach out to us and let us know what's going on after surgery. If you have a concern after your hip surgery, reach out to us. The phone tree at Tucson Orthopedic Institute is one avenue, and then alternatively, some people have an easy time with the patient portal where they can reach out electronically. But let us know about your concerns, and then you also should have in your original paperwork a follow-up appointment, often at about the 2-week mark. In closing, thanks for watching this brief video. Hope that your early recovery here in these early hours is going well. Take your physical therapy and your instructions very seriously, really work at it. We look forward to seeing you in the office in just a couple weeks, and reach out to us if you're having trouble.